My name is Lauren Bell. I'm in nursing 1119, and today I will be inserting and removing a nasogastric tube. So before we start, we'll go ahead and scan it. So I've already started by providing privacy. I have performed hand hygiene. I've gathered my supplies, and I've gotten those patient records to check for any orders such as this procedure and any allergies that the patient may have. So what I want to do now is go ahead and introduce myself. Hey, I'm Lauren. I'm going to be your student nurse today, and I'm just going to go ahead and check your wristband for that name and date of birth. Okay, great. So what we're going to be doing today is I'm going to be putting a tube in through your nose that'll go down into your stomach. This will help us with any kind of feeding, giving you medication, or any suctioning that we might need to. First, what I want to do is get you into a different position. I'm going to get them into this high flowers position. I want to be at a good working height. Alright, and I've got my suction tubing in case I need that, but we won't really be doing that today. So got you there, and I'm going to go ahead and assess the nostrils to see which one we're going to be using. Do you mind just push down on one side, breathe in, and then we'll do that to the other side? Okay, great. I heard a little bit of blockage in this left side, so we're going to use the right one today. So now what I want to do is grab my tube, and I'm going to measure. So to do this, we're going to go from the earlobe, tip of the nose, and I can't get my patient to turn the head, so I am on that earlobe. And there's the tip of the nose, and I'll remember that length and mark it, and then I will go down to the xiphoid process and mark that length as well. And I don't have a marker, so I'm going to use two for this. And that wouldn't be laying everywhere, but set that back down. I'm going to put a towel across the chest. I'm just going to lay this across you so that I don't get anything on you throughout the procedure. Alright, and I want to take my lube and put that on here to get that ready, and I've got tape there as well. So now I'm going to give you an emesis pan in case you need that throughout the procedure. And a cup of water. We'll need this in a little bit. And even this tissue, because there's a chance that you might have some tearing or some nasal drainage, and you might want that as well. So now, throughout the procedure, I'm going to go ahead and put my gloves on before we start. What I'm going to do is when I insert this tube, it might be a little bit uncomfortable for you, but if you get to a point where it's too uncomfortable and you want me to stop, I'm just going to ask that you raise that index finger, because you might not be able to talk, or let me know. But that'll just give me an indication that you're in pain or you're uncomfortable and I need to just stop and reassess. Alright, so I'm going to go ahead and take the tube. Now, if there's any kind of, my patient's turning cyanotic, coughing, can't even hum or anything like that, that's when I definitely want to stop. And we wouldn't remove this all the way, but we would back out slowly, reassess, and then go. Alright, so now I'll need you to just take your chin and bring that to your chest, and go ahead and take some of that water through your straw, and each time that the patient swallows, I will advance the tube a little bit further until we get to where we're going. Alright, so I've reached that tape. And I'm going to check the back of the throat for any coiling of that tube, which I do not see, so that's a good sign. And then if we're going to do any suctioning, I would go ahead and attach right here. If we were going to be feeding or administering medication, what I would do is I want to get an x-ray of the chest to just check for placement of that tube and make sure it's where it needs to be. Now, I'm I'm going to draw out with a syringe some gastric contents. Alright, I'm going to clamp that tube so that nothing comes out. Take this, empty that into here. I want to assess those gastric contents for anything abnormal and check the pH. Alright, now that this is clamped, which we would have an actual clamp on it, I'm going to take my tape. And my tape's not long enough because we ran out, but it would go across the nose, and I would hold that on there. And then I would take a safety pin, which I don't have as well, and clip it to the gown. Then I would leave this there. I would go ahead and perform any type of oral hygiene and also clean those nares as well. And I would take this away, towel, and remove these gloves. Alright, so I want to go ahead and get the patient back into a comfortable position, which is that head at 30 degrees. Alright, and I'll put on some clean gloves in case I did need to do oral hygiene again, and then make sure the patient's comfortable, has that call light within reach, the head of the bed's where it needs to be, and the rails would be up. So then I would leave after I've cleaned everything up, document my procedure, and then we would come back in later. So now this is a separate time. I'm coming in to remove that tube, and what I want to do is do all my universal beginnings, and then I would go ahead and explain to the patient what I would be doing today, which is removing the tube, and I want to get the patient into a semi-Fowler's position, which this is, and it's a little bit more comfortable for them. Let me just move some of this out of the way. Make it a towel. Place this across you in case anything gets messy. Then I'm going to put on my gloves. This would be a different pair, but a little short on gloves here. I'm going to go ahead and give you this tissue in case you need it, because your eyes may get a little bit waterier. That nose might as well. I'm going to remove this tape from your nose, and that tube's still in place. And I would also disconnect the suction from my tubing. And I'm going to want to flush. We want to flush with between 30 and 50 milliliters of air, so I'll do about 40. Alright, and I'll ask my patient to hold his breath while doing this. Push that through, clamp, and I can actually leave this attached, but it is clamped. Alright, so now I'm going to go ahead and pull this out. I'm going to roll all of this up in here, and I dispose of this per the facility's procedure, which I'm just going to set it right here instead of throwing it on the floor for now. And then I would want to go ahead and perform any type of oral hygiene that was needed. I turned my suction off, and I would want to clean those nares as well. Now I'll take these gloves off and dispose of them. Alright, I want to check and make sure that there's nothing else that my patient needs as far as oral hygiene goes. They're clean, happy, comfortable, and they are in a comfortable position with the bed rails up, the call light in reach, and I will perform hand hygiene before I leave and document my findings. So now we'll just scan the room one more time.